Using the Item Bank, a resource for designing data collection tools to evaluate gender violence prevention. Prepared by the Improve Group for Wisconsin's statewide Domestic Violence Prevention Initiative subgrant, a new opportunity offered by End Domestic Abuse Wisconsin. End Abuse was awarded the management of the statewide Domestic Violence Prevention Initiative. Funding is provided by the Wisconsin Department of Children and Families, Division of Safety and Permanence, Bureau of Safety and Well-Being. This webinar introduces you to the Prevention of Gender Violence Evaluation Item Bank, or Item Bank for short. It is a collection of items that measure the outcomes of gender violence prevention programming. Its main purpose is to help program staff develop their own evaluation data collection methods, also known as tools, such as surveys, interviews, focus groups, and environmental scans, as well as creative ways including photo voice or journaling. Don't know what tools to use? The Item Bank can also provide inspiration for deciding your data collection tools, scope of data, and data sources. Even earlier in your planning, the Item Bank can also be used to refine your logic model outcomes. While compiled by the Improve Group, an evaluation firm in Minnesota, the items in this bank are of existing data collection tools and compendia found in the interdisciplinary field of gender violence prevention. We organize the Item Bank primarily around two Centers for Disease Control and Prevention, risk and protective factor sources, one being Stop SV, a technical package to prevent sexual violence, and the other, Connecting the Dots, an overview of the links among multiple forms of violence. Sources of each item in the bank are listed and hyperlinked. We anticipate updating the Item Bank and welcome suggested additions so that it reflects the latest in evaluating such important efforts. The Improve Group developed this Item Bank in 2017 to build evaluation capacity of community-based organizations funded to design and implement dating violence prevention programming among youth. The Item Bank in your evaluation journey. The three purposes of the Item Bank are to inform the design of data collection tools, or earlier, to inform logic models and evaluation plans. At this point in your evaluation journey, you probably have developed a logic model of your program, including short-term, mid-term, and long-term outcomes. It is assumed that your logic model depicts the ideal state of your program. And as you've been introduced to the social ecological model as guidance in your evaluation, your plan likely includes 6 program outcomes, where 3 or 4 are individual outcomes, 1 or 2 are at the institutional level, and maybe 1 at most is an outcome you anticipate at the community or broader societal level. And it's assumed your outcomes are written in the ABCDE format. Audience, who or what the subject of the outcome is, the behavior, the thing you want to change, the condition, the intervention that creates the change, the degree, by how much it will change, and the evidence, what tool will be used to reveal that change. With a logic model and evaluation plan drafted, let's take, for example, an individual level outcome of increased knowledge of healthy relationships. How do you know this outcome has occurred? Evidence is in the items you choose to include in your data collection tools. Perhaps the best way to measure knowledge change is the number of correct responses to questions on a before and after knowledge test. But other legitimate ways are how individuals respond to particular questions in interviews or a change in participants' agreement with certain statements from a pre to a post-test survey. Each have different purposes and rationale for using them. Navigating the Item Bank. In the Item Bank, outcomes, the resulting changes of an intervention, are organized by the social ecological model, a public health prevention framework that considers the complex interplay among individual, relationship, community, and societal factors. Primary prevention influences change across all levels of the social ecological model. At the individual level, for example, Social change occurs when programs influence an individual's knowledge, attitude, belief, behavior, and skills. For example, individuals who know more about healthy relationships, have improved attitudes about gender equity, are likely to change their behaviors in ways such as positively influencing their peers or intervening in situations where someone is in an unhealthy relationship. Outcomes at the relational level pertain to the quality and extent of relationships among peers, friends, family, and with other adults. Outcomes in an institution, such as a school or workplace, are changes in policies, climate, and norms. For example, a school can improve its reporting process and policies so that marginalized students feel safe coming forward about harassment. Finally, community or societal outcomes are changes at a larger scale, such as improved conditions in gender equity and inclusivity, reduced relationship violence, and increased community investment in violence prevention. Items in this resource also reference protective and risk factors across the social ecological model. Protective factors are things that may lessen the likelihood of gender violence victimization or perpetration by buffering against risk. Risk factors are associated with a greater likelihood of gender violence perpetration and victimization. However, both protective and risk factors are best thought of as being contributors and not necessarily direct causes. Research in this area is ongoing. I'd like to introduce you to the term indicator, specifically outcome indicator. An outcome indicator is a specific, observable, and measurable characteristic that can be used to show changes or progress that a program is making toward achieving an outcome. In other words, an indicator is a sign that suggests you're on the right path towards influencing changes in individuals, institutions, communities, and society. Another way to think of an indicator is that, like protective factors, where the quality and number of protective factors informs the likelihood of experiencing a healthy life, results from outcome indicators provide evidence that an outcome is occurring or has occurred. This item bank contains hundreds of items, statements, questions, kinds of data, etc., that can be used as outcome indicators. You will need to decide how many indicators are appropriate for your program outcomes. One may be insufficient, but too many can detract from the goal or hinder the feasibility of your evaluation. Remember, when designing how you will measure outcomes, keep in mind what you are measuring. Are you measuring changes in attitude, beliefs, policy, social conditions, or skills? Depending on the area of change, you will need a well-fitting indicator or set of indicators. For example, early indicators of change in behavior include increased confidence, knowledge of how to do the behavior, and able to see opportunity for using the new behavior. Let's consider the scenario. We decided our outcomes, now we need to decide their measures. Let's start with the example of a knowledge outcome regarding healthy relationships. Before searching through the item bank, make sure you are clear about the kind of outcome for which you are aligning indicators. Knowledge is an individual level outcome, and knowledge about healthy relationships is a protective factor. Outcomes in the item bank are first organized by the social ecological model, then by type of outcome, and then whether it is a protective or risk factor. As for our example of knowledge change about healthy relationships, we will navigate to the individual level outcomes, look for the knowledge outcomes, and make sure it is a protective factor type item. We organize the item bank to present protective factors first, and then the risk factors. Let's look for indicators for the outcome. By the end of 1 year, youth will have increased knowledge of root causes of gender-based violence as evidenced by a pre- and post-test survey. Here we can see that item 11, the safe dates pre-post test, questions 8 through 17, would be worth considering. And the link is provided in the third column, source, as well as items 12 through 18 from various sources. Here's another outcome. By the end of program period, participants will improve their knowledge, conscious understanding, of Black history and culture by a great deal, as evidenced by changes in pre- and post-tests. An item to measure this outcome could be the Multi-Group Ethnic Identity Compendium, the agreement scale to statements such as, I have spent time trying to find out more about my own ethnic group, such as its history, traditions, and customs. This is item number 80 on page 16. Here's another outcome. Viewers will shift their attitudes away from strict gender roles and expectations, as evidence in comments that will be taken from social media websites and surveys taken from community engagements by the end of December 2018. You could consider pre- to post-test changes in agreement or disagreement to statements such as, more encouragement in a family should be given to sons than daughters to go to college. Girls should be more concerned with becoming good wives and mothers rather than desiring a professional or business career. And in general, the father should have greater authority than the mother in making family decisions. These are items 195, 196, and 198 on page 35 of the item bank. Let's look at another outcome. Upon completion of the program, participants will increase bystander intervention skills by 10%, as evidenced by changes in pre- and post-test scores. Perhaps you'd want to use the Men Can Stop Rape agreement scale to the statement, I feel confident that I can do something to prevent sexual violence. You could also use the Men Can Stop Rape's likelihood scale of doing something about a situation, such as, imagine you hear Robert in the cafeteria joking with his friends about Brianna's body, and then he touches her butt as she walks by the group. Brianna gets upset and leaves the cafeteria. So these are items 117 and 118 on page 22. Now let's look for items for this outcome. By the end of the 3-year initiative, there will be reduced inconsistency in the school's response to reported incidents of sexual harassment or assault, as evidenced by school climate survey. To measure that outcome, consider the percentage responding that their reporting of harassment or assault to school authorities results in effective intervention. This is an item from the National School Climate Survey, item number 286 on page 52. Another outcome example is that within 5 years, our community will have increased investment in prevention efforts by 1 point, as evidenced by the Community Readiness Score. The Community Readiness Assessment has some open-ended responses and scale responses to activities aligned with investment in prevention. These are items 303 to 305 on page 56. I hope that these examples help to show that using the item bank is really to gather indicators to help inform the extent that your program is or is not producing anticipated outcomes. And let's consider the second scenario. We still need to refine our outcomes on the program logic model. It can be daunting to make a strong claim that your program will change people, schools, work sites, and entire communities. You may be asking, where do we start? Can we really claim it will change anything? What kinds of changes can we make? Or perhaps you may be 2 pages deep in writing a long list of ideas for outcomes. Which ones are necessary? Feasible? No matter what, it is possible for you and your team to get a strong, concise, comprehensive set of outcomes across the social ecological model. If you are feeling unsure of where to begin, or you have a long list to refine, aim to create 6 outcomes. 3 or 4 that are at the individual level, and 1 or 2 at the institutional or community levels. Starting with the individual level outcomes, read through the headings and items about the kinds of changes in knowledge, attitude, beliefs, behaviors, and skills, or CABs. After reviewing these kinds of changes, create a list of current CABs among your participants to help you identify the things that could change. A clear vision for what your team wants differently in the end will help to answer questions like, what new knowledge do we anticipate them having at the end of our program? What kinds of attitudes towards gender do we want to instill in our participants? And what do we want participants doing differently? Once you do this exercise for each kind of individual outcome, go back to your program activities, curriculum guidance, and principles of prevention, and ask your team if it is likely that what you plan to do will create these kinds of changes in participants. If not, consider whether the activities or outcomes need to be adjusted. Refer to the item bank again for inspiration, or if you're satisfied with your outcome statements, then you can start creating your measures for individual level changes. Do the same exercise for the institutional changes, such as policies, laws, climate, norms, and conditions. Inspired by the item bank, brainstorm or prioritize the changes that align with your program activities. Furthermore, consider the alignment with behavioral changes in the people you reach, as those are the foundation to changes in institutions such as schools. Perhaps then, you may find that you need to bolster your activities to facilitate institutional level changes. Now it's your turn to work with the item bank. Insert a column, the purple shaded column here, between your outcome statements and your methods, otherwise known as tools, and then find items from the bank and add them to your evaluation plan. Not finding items to go with your outcomes? Search in related sections in the item bank. And if it still isn't serving your needs, you can do a Google search for indicators from credible sources. Now you do it. Let us know where you need help. Again, this was Using the Item Bank, a resource for designing data collection tools to evaluate gender violence prevention, prepared by the Improve Group.